Good evening, everyone. I want to welcome all of you tonight to Stockton-Tracy College. My name is Ms. Agulera-Lawrenson, and I have the pleasure of serving as the Superintendent President here at Delta College. I put my glasses on so I can read the next part. You know how that goes. All right, so first I want to welcome Congressman Josh Harder here today. This Representative Josh Harder was elected in 2018, and he proudly represents California's 9th Congressional District covering San Joaquin County. His family has been in San Joaquin County for 5 generations since his great-great-grandfather joined the wagon train in search of gold and stopped just short to start a peach farming in Chica. Representative Harder grew up in our community, seeing how working people are constantly left behind by politicians in Washington and Sacramento, and now he's fighting to make our voices heard by working to lower the cost of gas and housing, making our community safer and protecting our water. Representative Harder serves as a member of the Appropriations Committee, which controls the federal budget. He is the first member of Congress from the Central Valley to serve on the committee in almost 50 years, and uses his role to advocate for more federal funding for water infrastructure, healthcare, agriculture, veterans, and other local priorities. And he lives in Tracy with his wife Pam and their daughter Williams. It's my pleasure to welcome Congressman Harder. Thank you.
Thank you. Superintendent President, that's quite a mouthful. Thank you to our student body president, and thank you so much to everybody at Delta for hosting us. This is one of the best parts of my job, is out in our community, getting to hear directly from folks in our area about the concerns that they have. This is now month 4 of me representing Stockton. I've been in office for a little while, but given some of the geographic changes, we're spending a lot of time trying to introduce ourselves to folks and trying to make sure that we are hearing with an ear as close to the ground as possible what the concerns of Stockton and all of San Joaquin County are. I believe very strongly that the title of representative is not just a title, it's also a job description, and my job is not to sit behind a desk in some office building somewhere, but be out in the community as much as possible, and that's the real joy that I have in this role. We do a lot of town halls all across our area on a variety of topics. We do some where we talk about every topic under the sun. We do others that are very focused. And this is going to be a focused town hall. We've done a couple over the last couple months very focused on our water situation across our area, the Delta Tunnel proposed project, the flooding, the drought that we're dealing with. We've had a lot of wet days, sort of great rain for 3 years, and it came all at once this year. And I know that's probably why some folks are here today, because they are enjoying a beautiful, clear day, one of the first that we've had in a long time. But we're very focused on some of the water issues that we're dealing with. We have 70 years worth of snowpack essentially in the mountains, and a lot of that is going to melt in the next couple months. It's going to make its way down our area, and we have to do more to keep ourselves secure. So if we have questions about the water, happy to talk more outside of this video about some of the efforts that we're doing on that. But today we're going to be very focused on healthcare, and that's probably the topic that I get the most questions about across our area. It's also the reason that I'm in this job in the first place. My brother David was born 10 weeks premature. He was less than 2 pounds when he was first born. I couldn't even hold my baby brother in the first weeks of his life because he had all these tubes strapped up to him in the intensive care unit. I could only see behind the glass as all the nurses and doctors took care of him. He spent the first 2 years of his life essentially in and out of the hospital. And when he came out, the last time he had a health care bill that was 134 pages long. Luckily, we had the insurance to take care of it. Now he's healthy, he's thriving in our community, has a great job. But I think a lot about the fact that he wouldn't be able to see a doctor again if some of the protections for folks with pre-existing conditions were been reviewed. And I was at risk in our area a couple of years ago, and I felt like my brother's life and the life of many other people in our community was on the line. Committed myself to running for office to try to do something about it. And that's what we're trying to do. We have so many healthcare issues across our area that they really come down, I think, to 3 main issues. First, protecting Medicare, Medi-Cal, and insurance for folks with pre-existing conditions. That's under threat. Especially over the next few months, there are some people in Washington that not only want to raise security through the if you have an insurance card in our area, if you can't actually see a doctor or you can't actually afford your prescription. And cost and access are still big issues across Hamilton County. At the height of COVID, our beds, our ICU beds across our community were more than 100% full. We had 0% leftover capacity. If you had a heart attack, if you had a car accident, you take it to the emergency room, you might not get the high quality care that you needed, not because we didn't have the bed space, but because we didn't have the nurses and doctors to take care of you. We have a fraction of the doctors per person that people like the Bay Area have, just an hour or two away. We have got to work to make sure that we are bringing more clinicians to help serve our community. There's a family practice residency program in the Central Valley that I met with not all that long ago. Every year they graduate 12 physicians. Every year, only a handful of those actually stay. The rest go away and work in private practice in San Francisco and Los Angeles. And I don't fault a nurse or doctor that has to pay back their student loans, that has to work in private practice, that has to be able to keep their family alive. But we need doctors here now more than ever. And so one of the things that I'm working on is putting in place a loan repayment program, which would forgive the student debt of every nurse and doctor, every doctor working in an area of need across California. That should bring $10,000 to California over the next 5 years. That program starts this summer, and I think it's longer. The third thing that I'll talk about, and then open it up to our panelists, and then happy to take your questions, is the issue of costs. Now, we have a lot of folks that live paycheck to paycheck in our area, and half of San Joaquin County is diabetic or pre-diabetic. My dad's an optometrist. Every single week, my entire life, my dad has had at least one patient who has gone blind because of unmanaged diabetes. Not because they didn't know they were sick, but because in many cases they couldn't afford the insulin. There's so many folks paying thousands of dollars out of pocket for life-saving medications. That should not be the choice that they're faced with. And so we have to work. We worked last year to cap the price of insulin for Medicare beneficiaries, and we have to be able to expand that effort, not just for insulin, but for other life-saving medications, and ensure that people have drugs bill, get that prescription bill if they get it given to them or prescribed out of it. That's one of the most important things that we can do, because it doesn't help you if you have an insurance card. It doesn't help you if you finally get an appointment in to see that specialist or that doctor if you can't actually afford the healthcare treatments at the end of the day. It's not just prescription drugs. I think that's one of the most important costs that we have. So we've got a lot of work to do. We've made some progress in some of those efforts, bringing 10,000 doctors to our area, capping the price of insulin, but we still have a lot more work to go. So with that, I'm going to get behind here and I'm going to have a chance to introduce our two terrific panelists. And then we're going to be able to take questions from folks on whatever is top of mind. First, I'm so excited. Movie theater now. Not quite that. First up, I'm so excited to introduce the CEO of Community Medical Centers, Christne Noguera. Christne joined CNC in 2014 as a CEO. She brings to CNC over 35 years of experience in program development, health operations, and leadership. She has a Master's of Science in Healthcare Management from USF. She is one of the most important healthcare leaders across San Joaquin County. So we're so tremendous for her leadership across our area, and I'll open it up to her for some comments for the moment. Thank you so much for being here. Can we give a round of applause to
Thank you for that introduction. It's a real pleasure to be here tonight, and I can't agree more with the Congressman of some of the highlights of challenges that we are facing as healthcare providers in this county. First of all, I just want to give
access challenges, one of the biggest things is we are still fighting stigma, we are still fighting taboos, we are still not talking about
Mental health and substance abuse as something that is able to have a road to recovery. I think another piece that we often struggle with is that we forgot there was
a silent pandemic of mental health and substance abuse during the COVID pandemic. And my team has diligently been taking on that silent pandemic, which is not so silent any longer. And our increase of services, actually, just our Tracy clinic alone. So we do have a clinic in Tracy, we have a clinic in Lodi, we have our main hub here in Stockton, we do mobile, but just our small Tracy clinic, prior to the pandemic, served 468 people in 2019. We are close to 700 individuals open to our Tracy clinic. And that is a huge increase of services. To also go back to workforce, we have a 26% vacancy rate. So if any of you are looking for jobs, we are hiring. We actually have 928 allocated positions throughout our system with a 26% vacancy rate. As a licensed clinician, I still sometimes have to go out on the floor and put aside administrative work in order to make sure that there is some type of service in place. And I know many healthcare providers still do that. And so I am very grateful that you are trying to get workforce and residencies. We are in the process of working with St. Joe's on a site residency program so that we can actually have that full pipeline in and keep psychiatrists. So there's lots of different exciting things coming down towards behavioral health, but we do some really amazing things. We just aren't very good at the PR of letting everybody know all the good stuff that we do.
The phone number again, please.
Absolutely. It's 468-8700. We also have a warm line that's 24 hours, so that's peer-driven warm line. That's 468-3585. And we also have a 24-hour suicide prevention line, which is 1-800-273-8255.
Fantastic. Well, thank you so much for the work that you do. So now we get a chance to go to the meat of our program, which is to hear from all of you. So the way we're going to do this, how are we going to do this? So Melissa here is going to be running around up the steps, getting her cardio in with the microphone. Feel free to raise your hand with concerns, questions, ideas, suggestions. Melissa, you look at. All right. Looks like we have a couple already, and we'll go out and hear from all you.
Okay, thank you. Hello, I'm R.C. Thompson, the new Executive Director of Greenland South Stockton Coalition. I'm so glad to be here in support of healthcare for our valley. I have two questions. One of the questions were, I see that you have a bill here that you passed for getting more doctors and health practitioners into the schools. However, did you consider supporting practitioners coming to the valley and working within CBOs that are here? We have maintained through COVID supporting the people of greater Joaquin area, and we're needing some type of funding, more funding, support to support expanding within our collaborations and even our grassroots. So I do understand that behavioral health is the central that allows for the severe and moderate, but there is a slam that's happening with the mild to moderate individuals who are going into severe mode due to not being able to get appointments in time. I know someone very personally who set up in the psych ward and couldn't, had a breakdown finally after COVID and couldn't get connections to a therapist in time. And so I know larger entities like Kaiser, they're contracting out. But is there a bill that you're trying to see? Because RAMN is interested in supporting that. To support housing our practitioners here and giving them some type of moving stipend to live here in the valley. It has increased over 400% since before COVID. So when you take taxes out at the minimum CPO salary, which is maybe $65,000 to $75,000, and then you take
students at every stage. We need to make sure that we have more health science academies at high schools, middle schools, and elementary schools across San Joaquin County. So we're training our young people. So we don't have to go to, San Francisco and find a nurse or a doctor and convince them to move to Stockton. We got to grow them here, and we got to start as early as possible to do that. We also need more nursing programs and our medical school in the Central Valley. The Central Valley has 6 million people from Stockton to Bakersfield. We don't have a single full-scale medical school at all. That's outrageous. 6 million people without a medical school. We're trying to get one done at UC Merced. Yes, that's a little bit away, but it would be a huge help anytime we're training clinicians right here in the Valley. And that's not just helpful because of retention, because they're likely to stay here. It's helpful because we have a diverse community, and we need people that understand every aspect of every community across Stockton. If we're going to be able to treat our area with the best skilled people that actually understand the depth of that diversity. Then we need more residency programs. Then after residency programs, we need more retention. So I'd love to work with you if you have ideas about a bill that would help reinvent Stockton or any other community program. The civic architecture, the civic backbone of Stockton is strong. It is strong, but it is under a lot of stress and under a lot of tension. So I'd love to hear any ideas that we can do to help bring more folks to our area because God knows we need them.
And I can also explain a few things that we currently have. And so in partnership with Behavioral Health and the Board of Supervisors, we ended up advocating for ARPA money that we gave to Health Force Partners, which is an entity that will help give stipends and retention for CBOs, specifically for getting clinicians, nurses. There's a variety of different projects. Health Force Partners is the holder of that in order to bring additional individuals in. On the MHSA side, the Mental Health Service Act, so we are in the process right now of finishing up our 3-year plan. And our current plan should be open for public comment next Wednesday. Within that plan, we have a couple prevention-driven programs. One for cultural brokers, where we want to actually get the community and CBOs to help from a cultural perspective, do outreach and engagement to those who may need services, either mild to moderate or moderate to severe, and to link to the appropriate locations. But we're also actually going to be doing 2 RFPs for trauma mild to moderate services that will be funded through our MHSA as a preventative program so that someone won't need our services. So I'm hoping that some of our local community partners will actually respond to the RFP, expand their current programs, use some of our MHSA funds to offset some of their other funding streams in order to build a larger continuum, because I agree with you, there is not enough funds or resources for our CBOs, and we need to build out our CBO programming. We're just one piece of the puzzle. And in order to have the other puzzle pieces together to really make Stockton and San Joaquin as a whole a better place, I think we need to really lean in on our grassroots, our community partners to make that happen.
May I ask you a question on that follow-up?
Yes,
We are
ma'am.
concerned about Gavin Newsom cutting the budget from HSA, and he is going to be reallocating those funds towards the substance abuse program. So what is your pivot on that if your funds are cut?
That is a beautiful question. So everyone knows what the MHSA revamp, the proposal is that 30% of our MHSA funds will actually go to homeless housing, not for actual treatment pieces. So reallocating some of our MHSA to housing projects, 35% of those funds would go to full service partnerships, and then everything else would be put together. Everything else in terms of MHSA would be innovation, prevention and early intervention, our WET funds, which is our workforce investment funds, and so forth. So am I concerned? Absolutely, but I think we can get creative. And the reason I'm going to say we can get creative, if my team can be the team that provides technical assistance to our CBOs, we can draw down federal funds that we have left on the table for decades. So how do we figure out to use the skills that my team has to build Medi-Cal programming where you guys can draw down those funds that we can provide that technical assistance for, and then be like, okay, we're backing out because you guys already know how to do that. And I think if we are strategic over the next 18 months and we get those willing to learn how to do Medi-Cal with the new switch over to CalAIM and payment reform and documentation changes, then we can step out and we can just bring you that technical assistance, and then we can lean more in on the health plans be able to provide that assistance. So I'm hoping with the changes in MHSA, we wouldn't have to make the big pivot until fiscal year 25-26. So, and that's, there is a ballot measure that has to come into place in November. So there is a variety of things that have to happen. Do I think MHSA needs to be revamped? I do. I think there does need to be a revamp. But I think there also has to be a cultural revamp that my team can't do everything, but my team can provide knowledge so that other people can do that. Thank you.
Thank you. We have a bunch of other questions. Yeah, trying to make our response.
Thank you, Genevieve. I appreciate what you do, but you have a very, very difficult job, so thank you very much for what you do. So my question for you is, Senator Agney's SB 43.
Yes.
When I first was reading about that, I go, gosh, that's going to impact you in a major way. Yeah. Can you kind of give your thoughts on that? Were you for it, against it, or?
I will not say if I'm opposed or
Can you
it's
explain maybe what it is? I know we have some folks that are really into healthcare and a lot of other folks that maybe not so much.
So SB 43 actually changes the criteria for a 5150, which is the 72-hour hold. Currently, when you are evaluated to be put on a hold for 72 hours, it must have a primary of mental health services. So other things can be happening, but it has to be related to a mental health episode of some sort. SB 43 will say both substance abuse and mental health can be the primary. There is some concerns, and the reason there is concerns is our current inpatient unit is not certified for substance abuse withdrawal. In fact, it's two total different criteria. Do I think that SB 43 will help a great deal of people getting into treatment? Yes. Do I know how to do that with the current ways facilities are credentialed? No. But do I think that it gives us the opportunity to be creative? Does it give us the opportunity to ask people to help us build projects and to look at things differently? Because right now there is no legislation that says that I can put someone who is on meth, who is actively suicidal due to that meth, on a unit with somebody who has delusions and want to hurt themselves. Right now I can't put the two populations together because of the severity of the milieu. So do I think there is great value in it? Yes. Do I know how to do it yet? No. But will I get creative? Yes. But I think it has very good intentions. I think the intentions are good. We just don't have the infrastructure yet to do that. Senator Agulera has a great deal of passion, and she loves Stockton, so I'm certain that she'd be willing to have some conversations with us on how to make it actually work for us.
I have the next question right here.
Hi, let's talk. I'm Christne Gilbert, and I am the County Director for Health Force Partners Northern San Joaquin Valley, and I'm actually thrilled to be here tonight. I have heard so many great conversations with a lot of these different individuals, and I really want to thank you for holding this, because not only does it give us an opportunity to ask questions and to better understand some of the work you're doing, but it's an opportunity to stand up tonight and really applaud some of the people in this room who are doing amazing work. The collaborations are here. Health Force Partners has had the opportunity coming out of COVID to be at the table with Delta College, with Stan State, with CMC, with BHS. I really have to give so much credit to all of those individuals. There is exactly the work that you are trying to expand. It's happening now. And the partners are here and organized. And the thing that I believe so strongly in is there has to be, I've seen this in my work previous to this job. I've really only been with Health Force Partners for about 5-6 months now. In that there has to be a backbone organization who understands and brings the local community together across all of the various partners to bring together collaborations that actually solve local problems. In that I would love the big California or federal approach to things, and that we're drawing down funding, but we would love to have you at the table at some of these conversations where we have CMC and Delta College and Stan State and BHS and Health Force Partners with other groups together from the community talking about what we're doing. Just today I had lunch with a small group of people and identified 3 barriers for their CNAs and a few of their other students, and Health Force Partners could do something about it. I could probably do something about it tomorrow, but I didn't know it was there. And so these collaborations that we're having right now, we would love to invite you to be a part of them so that we can help tailor some of what you're doing to what we know is working here in San Joaquin County, because we are all lightning focused on helping our youth, and that term gets broader and broader. I just barely got out of that category, apparently. Helping our youth be able to find an education here, live here, work here, and reverse the brain drain. And I'm just really proud to be from here and proud of this work and thrilled that you came.
Next question.
Hi, I'm Randeep Joel, primary care doctor here in the Valley. Born in Stockton, residency in French dance here in the county, working as an attendant here still in the county. I actually wanted to highlight, and I think Genevieve kind of addressed it, but what we're seeing here on the ground level is having to counteract the legalization, normalization of drug use in the state. And we're kind of like floundering. And I see that as, we have CMC here. We have young people clogging up the entire system. The system was not designed for this. We have 20-year-olds, 18-year-olds, chest pain, gastric problems, having to refer them, clogging up the entire system. My question, I think, is what are we doing to help, kind of counteract the cultural shift dynamic here? Because it's falling on primary providers, nurse practitioners, PAs, and then the specialists, because they're having to deal with basically normal workups, but it's taking away from people who maybe just had an ST elevation MI, and we need an urgent cardiology referral. There's nothing for weeks for a cardiologist, right? So what I'm seeing and recognizing here is, what are we doing to counteract that? Are we going out, reaching out to adolescents and helping curb this? Because it's kind of a big contention here between what we need to do versus what the state is doing in terms of normalizing this.
Absolutely. I don't think I've lost track of that. I'm excited to hear from you or anybody else. We are dealing with an epidemic of drug use and substance use across all of California, maybe across the country, and it's really been supercharged by fentanyl over the last couple of years. And I've spoken to parents in our community, the parent of one high school student who bought another student when he thought was Adderall, turned out to be fentanyl, he overdosed and passed away. And that leaves a gaping hole in our community that's happening all too often. And it's not just our doctors who are asking me about this, it's our police officers, it's our firefighters. I did a town hall recently just with homeless individuals across our area, and the number one question when I asked, how can we help you? Their number one response to me was, help us get off drugs off the streets. Many of them were struggling with substance abuse, and part of that is, it's been existing for a long time. The Central Valley, we are a corridor for a lot of drugs coming up on I-5 and 99. We're a way station for some of that coming to the Bay Area that comes into our streets and into our homes all too often. There are a couple things that we need to do, in my view. One is, as you highlighted, most importantly, focus on prevention. An ounce of prevention is worth a pound of cure, and we have a lot of young people with too much time on their hands and not enough productive activities. I'd like to see a dramatic expansion in summer school opportunities, youth programs across our area. And that's not just for our drug problem, it's for our gaming program, and that's also just to make sure that we make the most out of the opportunity of our most important resource, which is our tremendous young people that want to steer in the right direction. So we have to be able to invest in those types of programs, and unfortunately, COVID made that very difficult because those are the programs at our schools that were cut the most dramatically. We also need a much better focus on recovery efforts. I've spoken to many young people in our area, and what they say is, even if I recognize that I have a problem, even if I raise my hand and say, I want to get into recovery, I get placed on a wait list. And that's unacceptable, because that may be a brief moment in time when that individual steps up and says, I need help. And then if they're not able to get it for weeks or months, that person is just going to spiral into a much worse situation. So one of the things that we were so excited to work with CMC on is a brand new recovery center in Manteca, the first of what I think we need a lot more of across our area. And then the third thing that I'll mention is I think we need much better law enforcement, not necessarily of the folks who are struggling on the streets, but a lot of frankly, the drug lords, the cartels that are acting with impunity across our area. We have what's called a high-intensity drug trafficking area in Central Valley, and we get a fraction of the federal funds for that, given the scale of the drugs that are coming into our area. And so we're working, I have a bill in Congress that I'm working on to get some of the horse tranquilizers that are added to fentanyl put on a federal schedule so that can be heavily regulated because that is resistant to Narcan and some of the overdose prevention efforts that we have. And so that's really the three-legged stool that I see. Prevention, 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 a lot of focus on recovery, and then there needs to be accountability for the folks that are propagating a lot of this effort. But excited to hear from our practitioners. Steve, do you have any?
Excuse me, just a few comments. Looking backwards a little bit, primary care, that means your pediatrician, your family practice, your internist, our health centers, for many, many years, truly ignored drug use. Partly because they were not trained, they didn't have tools, but over the last really 6 years, it's really become part of our practice. And it's being integrated into many, many primary care offices. First with screening, so that we can, assessments to try to pick up in a preventive of what's going on with whatever individual to try to identify any beginning drug use or chronic drug substance use. At the same time, at the medical centers, as we were developing the kind of integrated programs, we've also realized by talking to our partners, and I do want to give a shout out to this county. There's a lot of great collaboration between the care partners in this county, especially in the area of substance use treatment. So we identified a couple of gaps of where people would just either stop, there's nothing to do, or they could fall through the cracks. So within our health centers, we have started kind of our own hub and spoke program, where we do the assessment. The primary care providers actually start with treatment if it's something that they can begin to treat with what we call MAT, or counseling, group counseling, peer counseling. All that now is built in within our centers. And then we have what we're calling our recovery centers. One is at Waterloo. Our new one will be at Manteca. We have one in Tracy also, to help people begin that recovery journey and support them through the journey. Also here in Stockton, one of the very specific gaps that was identified was that one had a supportive withdrawal program. So that once you've gone through that initial withdrawal, that there be a place that somebody could go, stay, so they don't go back home where all those triggers are in the household, in the neighborhood, or the kid across the street, whatever it is. So we actually opened up what we call our respite center downtown on Channel. It has 14 beds, 24/7. We're learning as we're going about how to operate something like that. It's totally new. It's not part of what we've always done, but we decided it was a need. It was a gap in services. So people can stay for 14 days, get through those initial, and at the same time we're working in peer group support and trying to identify where they can go for their next piece of their journey. So there's more to do, there's no question about it, but there are collaborative partnerships and trying to get to some of these issues.
So I'm going to answer some of that as well. So behavioral health actually funds through the Office of Education, Prevention, Substance Abuse Services through the school district. So we do a variety of different things through them, but it's Office of Ed is operating it. Friday Night Live throughout some of the high schools is fully operated and funded through behavioral health. Public health, even though it's not my purview, has an opiate that has been initiated. They are always open to have people willing to come and have conversations with that. We are also trying to get contracts for youth residential substance abuse. There's only 2 in the state that takes Medi-Cal. One in LA and one in the South Bay. The South Bay will not take San Joaquin Medi-Cal beneficiaries because they have a 5-county contract. So any of our youth in Stockton and San Joaquin County that needs residential substance abuse, we have to send them to LA. And that is heartbreaking. So we are having lots of conversations regarding our opiate settlement money on how to potentially build a youth residential program. But that's 5, 6, 7 years down the road in order to make sure we build something efficiently and effectively. We also have outpatient substance abuse treatment for youth that do have Medi-Cal. So we have an outpatient program for 12 to 17-year-olds through our Railroad Square location, which is off of Oak Street. I think it's off of Oak. It's Railroad Square, and it's youth programming. We really have realized that a lot of our youth substance abuse are dual diagnosis. So youth with anxiety, youth with depression, who also have some substance abuse treatment needs. However, there is not a good dual diagnosis program as of yet. So we have already started conversations on how to build that. To circle back to the FHSU revamp, we're hoping that some of our prevention money and some of our outpatient money can actually be dual diagnosis driven so that we don't have to continue treatment long term. But I'm also going to add...
We don't have a ton of time.
Okay, one last piece. So what we have actually realized, so in my earlier life, I actually had my master's in education. And there is a direct correlation between literacy and substance abuse usage. So we actually want to do a focus on anything for prevention. We have to get our kids ready.
Thank you, I appreciate it. My name is Christne. I'm a Stockton native. I do a lot of census tract work and policy work, and we look at Stockton County as a whole. And in Tracy, one of the areas that we focus on, one census tract, over 30% of those individuals don't have health insurance. And so I know that the CMC down the street from there, the suburbs, there's a lot of healthcare facilities. So my question is, what are you doing to help introduce those individuals to the FQHCs? And what are you doing as far as the outreach strategy for those who know that we're here, we're going to help them out?
Well, it's obviously something the CMC needs to be working with you in partnership. Our FQHCs are absolutely there to provide the whole full gamut of services. Physical health, dental health, behavioral health to the uninsured. But I am really worried about our, what I just mentioned a little while ago, the determination by Medi-Cal, because that number could increase. But if there's something that we do have enrollment services at all of our sites to help move people into, because it's sort of a lot easier to access care if you have Medi-Cal or another type of insurance. And so that is part of our ongoing work. So if there's something that we can do to work with you, we're certainly wanting to do that.
So there's also a grant that Behavioral Health received with the PD in Tracy called the Friendly Faces Program, which we are just launching, where Behavioral Health, Public Health Whole Person Care, and the Tracy PD will actually go to the different homeless shelters and engage in order to get linkage to treatment. So the shelter in Tracy now has a behavioral health staff that goes there once a week and is always there. So if we need additional linkage to treatment, we know that we're not always the right treatment, but we can also assist with that. And I have a business card that you can get out.
The one thing that I'd say is that I think we have a lot of opportunities that people are eligible for that they often don't take advantage of. Access and health insurance is certainly one of them, but another is the constant stigma around mental health and substance abuse. And what I think we need to be doing a much better job of is leveraging trusted community partners. And that means our churches, that means our schools, that means our community organizations, places where people already go, where they already trust the individual that's offering that. And if we can leverage those partners in a much better way, one of the examples that I've seen successfully in Stanislaus County, we were just talking about this a little bit earlier, is what's called the Promotora program, where you create culturally competent messengers recruited from the community that go to the community. And they don't need a PhD and an MD. They need to to understand the communities that they serve. So I think if we do a much better job of working with our churches, working with our schools, and equipping them with the information and how to refer people to get help, we're going to be able to get a lot of folks that are eligible for these programs that don't take advantage of it.
We have time for one more question. Feel free to stay back and talk to the Congressman or the panelists afterwards.
My name is Che Adamson. I am a senior at Sac State right now. I'm going to graduate in May. The U.S. also spends more on healthcare than any other country in this world. And partly that is because we're the wealthiest country in the world, but that doesn't justify the out-of-pocket costs that many of us have to pay. And that is mostly seen through premiums and through prescription costs, and it doesn't justify, the money that we're spending doesn't justify the returns. You mentioned that obtaining Medicare and Medi-Cal is crucial, and I agree with you. But Medi-Cal stops coverage when you're beyond 133% of the poverty line. And so, arguably, the reason that we have such high healthcare costs in this country is because we are drowning in third-party costs. And so, my question to you is, what is your plan to combat these rising healthcare costs? And is there anybody currently in DC that you're working with that is working with you on this issue?
It's a great question. I think it's complicated answer. Healthcare is a huge percentage of our economy, and there's so many folks that are middlemen throughout the system that take a lot of money out of our pockets and don't provide a whole lot of value. They don't really contribute much to the system. And so the way to think about it conceptually is we need to make sure that we are putting that money towards providers, towards people that are actually on the front lines providing health care, and not to the middlemen all between that only move paper back and forth and don't actually help them. So a perfect example of that are what are called pharmacy benefit managers, which is essentially the level between a pharmacy, or maybe I've never heard of that term if you don't work in healthcare directly, but there's a lot of folks that are between the level of a pharmacy, when you go to your local CVS or Walgreens or your community pharmacy, and the actual medication manufacturers themselves. And those folks don't really do much, but they add a whole bunch of costs to that system. And if you think about a drug like insulin, I bring up insulin again and again, not just because it's probably the most common drug prescribed across San Joaquin County, but also it's a drug that was discovered decades ago, a very long time ago. The University of Toronto, the doctors who developed that medication, life-saving drug, never patented it. They actually gave it up to the world for free because they knew it was so important. And yet, again and again, people have taken costs and dramatically raised the cost of insulin and other life-saving medications. So we started there last year by capping that price. We should go much further. We still need to develop new drugs. We still need to create incentives for folks to go out and discover the next insulin. But there's no reason that we should be paying 2 to 3 times what folks are paying in Canada for the exact same scientific molecule. It makes absolutely no sense. So I think if we can do those two things, if we can really tighten the middleman in healthcare, remove a lot of the waste that doesn't provide value but adds a lot of cost, and if we can make sure that we rationalize the costs that we pay that are far, far in excess of what people pay in Canada or the European Union or anywhere across the rest of the world, then we can ensure that we can deliver high quality care to our area. And that's a really important issue because I talked to a senior in Stockton the other day who told me he cried when he got his Medicare card in the mail for the first time because he knew his family was not going to be on the hook for his cancer treatments. And that's all too common. And you shouldn't have to wait until you actually are eligible for Medicare to get the access to the care. I've seen it in my own family. We have to ensure that everybody across our area doesn't have to make that decision between going and paying for their gas, picking up their groceries, or actually paying their health care bill. But you guys are the experts. Anything that you would add about things we could be doing to cut costs and help folks? That was it. I figured it out.
I wish I had a good answer for you. I don't. I think there's ways that we can do partnerships though better in terms of private and public that would decrease so much red tape. But I think there's options. I think there's ways around it. I just don't know the answer yet, but I'll find it.
I think we are at a tipping point, though. The pharma companies have had an outsized influence in our political system for decades. And frankly, until last year, they had never lost a battle in American politics. They had never asked for something that they didn't get. That's outrageous. That doesn't make any sense. When I first decided to run for office, I made a pledge to not accept any money from any corporation, especially any pharma companies. That's a voluntary pledge that I make to this day, never have, never will. I've also written legislation to mandate that for every member of Congress. It doesn't make me the most popular person in Washington all that often. I don't expect it to pass tomorrow, but it's a flag in the sand of the values that I think we should have. And that has enabled us, the more people that have signed on to that pledge, the more people we actually have to vote for communities like ours that don't have a lot of pharma companies, that don't care much about their profits, but have a lot of folks that bear those costs. And so I think if we can have more people that actually think about that, the more chance we have of building that coalition of change. And I think we have achieved that.
One little thing. I would urge you to find an FQHC if you're not already going to an FQHC. Many FQHCs have our own pharmacies where we have what we call 340B medications available at significant cost savings. So that would be my one suggestion. It's not the answer to the whole healthcare problem, but certainly if you're right on that edge of losing Medi-Cal, that's exactly what our FQHCs are about too.
Tremendous. Well, I know we've covered a ton of ground. Thank you so much all for everybody